everyone, welcome back to our channel. I'm Dr. Ramel from City Skin Clinic, and today I wanted to have a little chat with you about my favorite peels for acne. So these are chemical peels that resurface the skin, and we're going to have a little chat about how these peels work and what the difference is between them. So if you haven't already checked out our previous acne content, I've done a video about acne and what kind of treatments you can do in terms of at home versus professional skincare and in clinic. And also there's a video about tretinoin, which is fantastic if you're suffering from acne as well. And our professional Obagi Derm MD at-home acne system. I'm going to leave a link to these videos below so you can check them out. So in terms of chemical peels, we've previously done a couple of videos about chemical peels, but these are agents, they're acidic, and they resurface the skin. So normally they work by getting rid of the dead skin and to then reveal layers of younger skin. That's kind of just a rough idea, and different peels do different things. So for acne, as you know, we've kind of previously discussed how the process of acne works, and it's a combination of abnormal keratinization, which is just the keratin on the top of the skin, and you get some of these cells and the keratin plugging pores, and you also have an inflammatory process and an overgrowth of P. acnes bacteria, and all of these things together lead to inflamed skin, blocked pores, pimples and breakouts and swelling, which we typically see in acne. And after that, of course, when acne is a cycle of kind of flare-ups, as well as the after effects, which could be hyperpigmentation, it can be scarring, and I will do some other videos about treatments for those separately, but right now it's about active acne. So chemical peels wise, what you're looking for is for agents and peels that are going to help with the inflammation and help with removing that kind of abnormal keratinization in the dead skin that's clogging, and you want to unclog the pores as well. So at the most common type of peel is beta hydroxy acid, salicylic acid. It's an ingredient anyone who suffers from acne will kind of know and have come across. So salicylic acid peels are great. They're considered superficial peels, and that just means that the downtime is low. So whilst they resurface the skin, they don't go very deep. And so that means that initially you might have a little bit of redness, you might have a tiny bit of flaking of skin, but really you're good to go. If, for example, you have an important event in a day or a couple of days, or you really can't afford to have any skin shedding or peeling, then you want a superficial peel, and they're great for that. The other thing with superficial peels is you can use them more regularly than deeper peels. So on the other end of the scale are deep chemical peels. These go all the way down towards the dermis, and these peels, whilst they can really make a massive effect, so you can get a real resurfacing of the skin, they're actually quite intense. You have a downtime of several weeks where the skin is red, it's swollen, it's crusting. Usually with chemical peels, they have to be, people may need sedation for them, so it's a very involved process, and it's not something that people commonly get these days. They may usually have them in the context of having you know, maybe after plastic surgery, where you also want to resurface and improve the skin, or something really involved. More commonly, if you want something that's a little bit more effective than a superficial peel, and you don't mind a little bit of downtime, is a medium depth peel, and this is what I will mention today. So my absolute favorite medium depth peel for acne is the Jesna peel, or as it's more commonly these days we use in our clinic, for example, the modified Jesna peel. This is a peel that's made up of 3 different peeling agents, and these include resorcinol and salicylic acid. And with this peel, what you're doing is each of these ingredients will firstly resurface the skin. It will get rid of the dead skin cells and disconnect the glue between them. And then it will unclog pores and also target inflammation, so reduce inflammation. It's a fantastic medium depth peel. You can expect peeling of skin, nothing extremely severe that can't be covered up with makeup, but you'll find that you're having to moisturize a lot. It's not something you want to have done you know, a couple of days or even a week before your wedding, for example, or any important event, but it's fantastic for really getting a very effective treatment if you don't mind a little bit of downtime. And then the other kind of peel that's becoming a little bit more common that I want to talk about is retinol peels, and these I would say are more on the between the superficial and medium depth. These are fantastic peels, and they can be combined with a salicylic peel or with a Jesna peel. Retinol and other vitamin A derivatives are used for acne. They're very effective. They work again by getting rid of abnormal keratinization, but they also can help with the inflammatory response and with bacteria as well. And retinol or retinoids, I always advise, unless you are pregnant or breastfeeding or have an allergy to them, they're something that you should be using regularly, both for their anti-aging effects, but also because they help with acne, so if you suffer from that. Retinol and the modified Jesna peels, as well as active acne, they're really helpful with things like hyperpigmentation and also softening the skin. So whilst they won't get rid of scarring, they will help over time improve that. And both these peels are also good if on top of that you have a bit of fine lines and wrinkles. So they're great in terms of evening out skin tone and kind of treating some of the after effects of acne. All of these peels should be performed in a medical setting, so you should really not go for kind of at-home kits with these peels. But if you wanted to have an effect, a little bit of an effect with these ingredients, there are at-home toners. So one of the ones I like is the Paula's Choice, and that's a salicylic acid, that's a 2% BHA. It's gentle enough to use that every day or every other day on your skin, and that will help give you a little bit of an effect. You can also, like I mentioned, use retinol. There are some retinol masks that you can also have, but as far as chemical peels are concerned, you should always have them professionally done. There is a risk of burning the skin, there is a risk of allergies, and that's why you should go to a qualified medical professional to have them done. Anyway, I hope you enjoyed this little bit about my favorite peels, and until next time, bye.